In Katie's capsule of the day, we're going to talk about A1C and what that number means to you. In Katie's capsule of the day, I'm going to unpack exactly what is an A1C. So an A1C is a test that's used to determine if someone might be diabetic. Now, one test will not determine if you're going to be diagnosed with diabetes. Multiple tests are needed. Once someone is diagnosed with diabetes, the A1C test will also be used to find out how the disease is being managed or not managed. So the A1C measures the hemoglobin protein, the amount of hemoglobin protein that's been glycosylated or coated in sugar. Now, if you can imagine hemoglobin is the carrier for your oxygen, and maybe that carrier for your oxygen's got a lot of luggage that they're trying to carry, which will be the sugar luggage. So it's not going to be as efficient if it's carrying a bunch of luggage, or maybe another example would be like monkeys on its back. So you don't want your hemoglobin to have monkeys on its back when it's trying to carry your oxygen to important parts of your body. I have 3 test tubes to be able to demonstrate to you a little bit of what that might look like if your A1Cs are not within range. If your A1C is less than 7, then your blood will flow pretty well. Depending on what your provider is using for their goals, they may also have a tighter expectation for you to have an A1C of less than 6. If you can notice that the white balls are the oxygen, and it's going to be able to flow to all where you need it to, your eyes, your kidneys, your nerves. So that's going to be flowing really well. But what if your A1C is between 7 and 12? It will not be flowing as well. So it's still moving, but the oxygen kind of gets stuck in corners and may not completely get to where you need it to. For diabetic patients that A1C is not within range, they may notice that their ability to heal from wounds has been decreased. It's very important to make sure to have annual vision screenings and to have foot exams. There's also neuropathy risk as well. If your A1C is greater than 12, though, that's when we really see so many monkeys on the back of your hemoglobin. And it is all thick like molasses as your body is trying to get the oxygen to the places it needs to. And that's a big part of why diabetes can be so devastating, because it cuts off the oxygen to where your body needs it, and you can have long-term complications from diabetes. So what does that correlate as far as numbers on your blood glucose levels on a daily basis? Now, when you test your blood glucose, that's only giving you a snapshot of what's happening at that exact moment you're testing your blood glucose. And your blood glucose will have more of a up and down motion throughout the day instead of it just being straight across. Our body takes in energy and processes energy, so your body's insulin will be able to act in order to respond to that intake and make sure it's stored properly. So if, for instance, your A1C was around 7, that would approximately correlate to like 154 milligrams per deciliter of blood glucose level. If it was closer to 12, that might be closer to 298 tests of blood glucose. And those are just estimations, of course. But as you can see, if your blood glucose is running around the 300s, a lot of patients will see that number and know that that's a really high number that you want to make sure and stay away from. Just knowing that a number is a number, but how do you make sure that that number makes a difference to you? So anybody that is struggling with diabetes, the biggest suggestion I can make to you is to not always just get stuck on the numbers, but to see what adjustments you can make in your life. You don't have to get it all figured out in a day, and you don't have to have a perfect lifestyle in a day either. But every day you can make better choices, and those baby steps can continue to build to where you are effectively managing your diabetes disease state with the partnership of your pharmacist and your doctor. Hope you have a wonderful day.